NCLEX RN Practice Test Quizlet 2026 Questions for Interactive Learning. Question 1. A clinic patient prescribed nitroglycerin for angina calls complaining of frequent headaches. Which of the following responses is correct? Option A. Stop taking the nitroglycerin. Option B. Go to the emergency department. Option C. Headaches are a frequent side effect because it causes vasodilation. Option D. The headaches are unlikely to be related. The correct answer is option C. Headaches are a frequent side effect because it causes vasodilation. Nitroglycerin causes systemic vasodilation, which frequently results in headaches. This is a common and expected side effect. Question 2. A patient in remission from colon cancer complains of fatigue and difficulty with concentration. Which of the following explanations would account for her symptoms? Option A. The symptoms may be the result of anemia caused by chemotherapy. Option B. The patient may be immunosuppressed. Option C. The patient may be depressed. Option D. The patient may be dehydrated. The correct answer is option A. The symptoms may be the result of anemia caused by chemotherapy. Chemotherapy can cause long-term bone marrow suppression and anemia, which manifests as fatigue and brain fog or difficulty concentrating. Question 3. A clinic patient has a hemoglobin concentration of 10.8 g/dl and reports a strict vegetarian diet. Which nutritional advice is appropriate? Option A. The diet is providing adequate sources of iron. Option B. The patient should add meat to her diet. Option C. The patient should use iron cookware and eat dark green leafy vegetables. Option D. A cup of coffee should be added to every meal. The correct answer is option C. The patient should use iron cookware and eat dark green leafy vegetables. Vegetarians can maintain iron levels by using iron cookware and consuming non-heme iron sources like legumes and leafy greens. Question 4. A patient is receiving packed red blood cells, PRBCs, for severe anemia. Which of the following is the most accurate statement? Option A. A transfusion reaction is most likely after the infusion is completed. Option B. PRBCs are best infused through a 20 G/4 catheter. Option C. PRBCs should be flushed with a 5% dextrose solution. Option D. A nurse should remain in the room during the first 15 minutes of infusion. The correct answer is option D. A nurse should remain in the room during the first 15 minutes of infusion. Most hemolytic reactions occur within the first 50 ml of the infusion, therefore, close monitoring in the first 15 minutes is vital. Question 5. A patient who has received chemotherapy is given an injection of epoetin. Which of the following should reflect the findings in a CBC several days later? Option A. An increase in neutrophil count. Option B. An increase in hematocrit. Option C. An increase in platelet count. Option D. An increase in serum iron. The correct answer is option B. An increase in hematocrit. Epoetin alpha stimulates the production of red blood cells, which is reflected as an increase in hematocrit and hemoglobin. Question 6. A patient is admitted with suspected polycythemia vera. Which of the following symptoms is consistent with the diagnosis? Option A. Weight loss. Option B. Increased clotting time. Option C. Hypertension. Option D. Headaches. The correct answer is option D. Headaches. In polycythemia vera, the blood becomes hyperviscous, thick, which frequently causes headaches, dizziness, and visual disturbances. Question 7. A nurse is caring for a patient with a platelet count of 20,000/microliter. Which of the following is an important intervention? Option A. Observe for evidence of spontaneous bleeding. Option B. Limit visitors to family only. Option C. Give aspirin in case of headaches. Option D. Impose immune precautions. The correct answer is option A. Observe for evidence of spontaneous bleeding. A platelet count below 20,000 puts the patient at high risk for spontaneous, life-threatening bleeding. Question 8. A nurse assesses a patient who has been taking long-term corticosteroids. Which of the following is a typical side effect? Select all that apply. Option A. Hypertension. Option B. Cushingoid features. Option C. Hyponatremia. Option D, low serum albumin. The correct answer is option B, Cushingoid features. Long-term corticosteroid use leads to Cushingoid features, such as a moon face, buffalo hump, and central obesity.